يا هلا 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 حن قلبي على جمعة الخير هلا حن قلبي على جمعة الخير هلا يا هلا ويا هلا ويا هلا ويا هلا يا هلا ويا هلا ويا
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and welcome to another Let's Talk coming to you from our Sunning Hill studios in Johannesburg. This is ITV Networks. I'm very excited about the show this morning. We have two doctors on the show, but from two totally different disciplines. The first one is Dr. Shaida Jansen. She is a clinical psychologist from the Western Cape. We also have Dr. Jamil Desai. He is a maxillofacial surgeon. And in the middle of those two doctors, we have the lovely Nadira Chenya talking about Syrian orphanages. So all of that on the show. We do hope you're going to keep us company. And let's get right to the heart of the matter by welcoming the lovely Dr. Shaida Jansen, all the way from the Western Cape. Assalamu alaikum.
Wa alaikum salam, Julie, and thank you for having me.
Lovely to have you on the show. Couldn't wait to have you here. I've been nagging you for a while to join us in the studios here in Johannesburg. So great to have you here. You are a clinical psychologist by profession, but you have spent most of your professional life, so to speak, in academia. Tell us a little bit about that.
In higher education. So after I qualified as a psychologist, I worked immediately after qualifying. I actually worked in the health services, in health program development at the University of Cape Town. So I worked there for about 5 years, and then thereafter I went into private practice for a short while, and then started at the University of the Western Cape, where I had been coordinating and managing the counselling services for the university students for many years. And part of that was also where I supervised and I trained master's level psychology interns, because the counselling service was also accredited with the Health Professions Council to train and supervise both clinical as well as counselling psychology interns. And then since October, now last year, I started at the University of South Africa. I'm the Deputy Director of Academic Support and ICT at the Cape Town campus. So, in fact, my identity as a psychologist possibly gave way for my identity as a student affairs professional, where I use psychology and apply it in an academic environment. In other words, to make sure that we have throughput and output, that our students coming through universities, that they pass and that they graduate in the allotted time, and that we translate the academic content into a form in which will promote the student uptake of the knowledge and the information. So I think that's perhaps says a little bit about my work as a psychologist within higher education.
As a clinician, you have 3 areas of specialization. What are those?
Okay, so my 3 areas of specialization, these are the areas that I have been presenting at conferences each year, and that I had developed as a clinical psychologist. So one of it is the enculturation of psychology. In other words, what I do is I take the psychological content as I had received it, in my training, and I adapt it to local cultural frames, local knowledge, local meaning frames of people, so that the knowledge that the psychology student, the knowledge that they learn at university is consistent with local meaning frames, and also if you as a client...
Their frame of reference.
Their frame of reference. And if you as a client seeking psychological service, that psychological intervention, the psychotherapy that you receive also makes sense in terms of your own meaning frame. So that's broadly this, enculturation of psychology. That's what I've done. And then part of that has been... I've enculturated small group dynamics, so I train other psychologists as well as psychology students in the use of small group dynamics for the sake of behavior change and personal transformation. And that in itself I have also enculturated with local understanding of the self, right? And then the third area of specialization is the masculinization of psychology. So I work with men. So what I've done, I've noticed that there is an absence or a lack of attending to men within psychological services.
However, is that not simply because men don't like this whole notion of counseling and psychology and putting up this strong male figure, macho male figure of theirs, that they don't need to be counseled? They're in control. They can deal with their stuff. They don't need to go into therapy to deal with their stuff.
So what you are, that's a very valid observation that you're making, Julie, because both in the literature, in the academic literature, as well as anecdotally, what is often said is that men don't deal with feelings. Yeah,
and it is also okay for men to cry.
But what I had done in terms of the masculinization of the psychotherapy, I think that again, if you want to present something to somebody, you must do it in such a way that it affirms their own cultural frame. So what I have done, for instance, when I started running men's groups, and these groups, the purpose of these groups were to deal with emotions. Not just anger, not just aggression, but all of your emotions, including the emotions that any man might experience. And so when I run these groups for men, I do it in such a way that men can deal with also their tender feelings, also their vulnerable feelings. They can deal with sadness or about relationships without compromising the man code or their own masculinity. So in fact, what I have discovered in my work is that men are in fact very good at dealing with their feelings. But I think it is about doing it in such a way that they feel they can do it in their own man way. And then they don't seem to be a problem.
I want to talk about Spirit Meets Psyche. It's very, very fascinating. It's work you've done. But before we get there, I also want to ask you about this resistance, you know, by men to go into counseling or into therapy, very especially in a situation where there are marital issues. And they don't like unpacking their stuff in the presence of a therapist and the wife being there as well. How do we deal with that? How have you dealt with those type of situations, if you have?
Yeah. Can I just, and because I want to go on to the discussion now about where spirit meets psyche, and where I talk about the integration of how do we use spiritual resources for the sake of behavior change, for the sake of humanization, for the sake of making a person fully human. So when you masculinize the psychotherapy, when you deal with a man in such a way that he can deal with his feelings and he can still be a man in whatever man code, you know, he's been socialized in, it means you are spiritualizing
How do you do that?
You are enculturating the psychotherapy. For instance, when I used to run the men's groups at the University of the Western Cape, one of the things I used to do was the therapy, for instance, used to be a lot more action orientated. We often assume that we have to talk about feelings. Maybe some people, men and women, can talk about their feelings, but there are some people who prefer to do it in a more action-orientated manner, not necessarily talking, but expressing themselves in different ways.
For example,
still dealing with their feelings.
For example,
we would in some of the groups that I ran with the young men on campus, we would start the group by having an icebreaker activity, for instance, or an activity that requires them to actually to do team building with each other, to get to know one another, but in a way that required that they actually cooperate. So I would set up an activity where they actually, as a group, have to integrate with each other, cooperate with each other, find one another, exchange ideas, learn from one another. And they were very able to do that, you know. So in other words, we did cooperation, we did reflection on who I am, or introducing who I am, or explaining who I am, without necessarily it being in this very verbal, touchy-feely way. But they still addressed feelings. So,
and then you as a therapist, how were you able to identify what the issues were then, without them expressing it verbally, what's going on in their heads?
Okay, so let me talk about the integration of spirituality into psychotherapy. So when I deal with a client, right at the beginning, the contract that I enter into with a client, be it a male or be it a female, be it an individual or be it a group, that this is the context in which certain things will be said and certain responsibilities will be taken for both good and bad behavior. So once you start contracting that this is a place where it will be safe for you to speak up, as long as you take responsibility, as long as you are prepared to do the work that is required for you to change your behavior, for you to take a meta position on yourself and to reflect, oh, this is what I'm like. And then you prepare to do the work that will require you to shift from, for instance, not being able to tolerate looking at yourself to being able to tolerate, yes, I am like that. Yes, this is what needs to change.
And that must be very difficult to see yourself in this glaring light. Can we just hold that thought and take an ad break? Let's take our first ad break for the morning. I'm talking to Dr. Shaida Jansen. She's visiting Johannesburg all the way from the Western Cape and very kindly agreed to come in to do the interview. And of course, she is a clinical psychologist by profession. Do join us right after the ad break when we continue talking about spirit meets psyche. We're talking to Dr. Shaida Jansen. She is a clinical psychologist and she is talking to us about spirit meeting psyche. Shaida, I interrupted you before the ad break. Do you just want to finish that thought and then we can continue? And I know you're very, very keen to talk about the personality and character of our beloved Nabi Karim sallallahu alaihi wasallam and how that works as far as modern day psychology is concerned.
Okay. I think for me, you know, the integration of spirituality with psychology, I wanted to come into it from the faith-based community's perspective. What I've noticed is that there seems to be an understanding that if I have a problem, I only need to pray on it. Right? Now, what I'm wanting to, I guess the conversation for me is about reflecting on the extent to which, when we are praying or we're coming from a spiritual perspective, we are already being human. So so prayer and psychology speaks to the same thing. When you go see a psychologist, you're probably interested in improving your self-esteem. You want to be a good parent for your children. You want to uplift your mood. You want to be a pleasant person. When you, for instance, go and see a pastor or an imam, and you take your concerns to that pastor or that imam, the goal might be the same. It's also for you, you want to be a better person. You want to be an upstanding member of the community.
Or you need help in getting there.
Or you need help in getting there. So I think this whole notion that there's a split between the spiritual and the psychological is, in fact, perhaps something that we have constructed ourselves. In reality, it isn't there. And the reason why I'm saying in reality it isn't there, when you take, for instance, religion, the religious traditions, let's just take the Abrahamic faiths, Judaism, Christianity, Islam, or we can also add in traditional African religion because we are on the African continent. What you find is that if you take the scriptures that reached humankind, these scriptures did not drop from the sky. It came through human beings. So Jesus as a prophet, for instance, he was inspired with God's word. So that tells you
as
that...
were all the prophets.
As were all the other prophets. So Moses or Adam or Prophet Muhammad. So you find that these were people coming with a spiritual message, but they were human beings, right? Like me, they were not angels. They were special human beings, but they were human beings nevertheless. So right from the beginning then, in terms of the way the religious traditions evolved, they evolved through human beings. Then if another thing that I want to take from the spiritual tradition, if you look at how the understanding of a human being, we are partly terrestrial and we are partly celestial. So in other words, Adam was made of clay, so we are of the earth, we are fully human, which means we've got feelings, we've got negative and positive impulses. We can feel sad when we lose something. We can feel happy and enthusiastic when we are excited. So, and then we also have parts of ourselves that we struggle with, all right? Parts of ourselves that confront us. And
possibly the darker sides of our personality.
Exactly. So in other words, so that's what I'm saying is that just from the way we are put together as human beings, we are a combination of spirit and we are a combination of earth, right? So now when you draw on, say, the example of the Prophet, Nabi Muhammad sallallahu alaihi wasallam. So what you will find is that here was a man. Now, if you look at just in terms of the most famous story of how he married this very noble businesswoman. Now, if we look at what attracted Khadija to this man, Muhammad, then you find it was his kindness, it was his generosity, but it was also his business acumen. She saw that her business was making a profit when Muhammad started to trade in her business. So in other words, you will see that this was before this man got revelation. He only became inspired with revelation at the age of 40. Mm-hmm. But he was 25 when he married her, and she recognized in him good human qualities. So let's go further in terms of Muhammad's human qualities. So for me as a psychologist, when I look at the way he expressed himself, I noticed that he was an emotionally expressive man. He used to, apparently when his daughter Fatima came into the room, he would get up and he would hug her. So he could express his feelings. He would play with the children. So it also means, like we would say as psychologists, he was in touch with a child within him. Even though he was an adult, he could get playful, all right? And if you look at the second wife, Sitina Aisha, she was very intelligent and she was quite a strong personality. And she'd speak back to him and they would have,
possibly challenged him.
Oh, definitely. Mm-hmm. So what you find is that if this is the man that is the model for modern Muslims, then this is a man for me that embodied that spirit, and the psychological is housed in the same place. That there should not be, if you go to the mosque every day and you pray 5 times a day, so it means that, from a outward perspective, we will say that you are a spiritual person. So when we go home with you, and then the way you treat your wife and the way you are with your children, you should be loving with them.
There shouldn't be a clash.
There should not be a clash. They must not be scared of you. They should be able to come to you. They should hear from you that you love them.
So in modern times, there seems to be the split. What is the reason for it? Why? Not only men, I talk about human beings in general. So you have the spirituality, you have this aspect that is very active in our lives as Muslims, and yet we have this darker side which we allow to possibly overshadow the spirituality. What is going wrong here? How can we overcome? And surely that is what is putting us in anguish and turmoil.
That we have, in fact, so now I come back to the fact that an academic, Dr. Michael Hart, when he wrote his book and he chose the 100 most influential people in the modern world, he chose Prophet Muhammad as the number one influential person of the 100 most influential people in the modern world. So that in itself is perhaps neither here or there. But then when you go ask Dr. Hart, why did you choose Muhammad as the number one influential person? Then he will say he said, I chose him because he was one person in the modern time that was supremely successful, both spiritually and in worldly ways. So in other words,
he had a totally balanced life.
There was no split with him.
Yeah.
He was a father, he was a present father, he was a partner that was responsive to his wives, he engaged them, they could challenge him, women used to come to him and take issue with all sorts of things, and he, in fact, he is known to have taken very good care of women and of orphans. He was very kind, and so he was a governor, he was a statesman, he went out on the battlefield. So here was a man who did not spend his time just on a prayer mat, although apparently, he spent a lot of time in the desert, meditating completely by himself. But he made time to be engaged with all the challenges we have
and all the different aspects of his life.
All the different aspects. So you see this holism. You don't see this, nowadays, you find that often the people who may be very prayerful are also maybe the people that may not be the kindest, nicest person that you want to be around, You find in the corridors of academia, you may find this professor who is so well published, but then the personality of this person is he's not a very kind, So it's not just people from the spiritual side, but also sometimes people who are perhaps very wealthy or people who are very intelligent. You find that very, very wealthy or very intelligent, but not very kind.
Not very nice
not
people.
Very approachable.
Now, unfortunately, we don't have much time left, and I could go on talking to you for hours on end. We touched on the amazing personality of the greatest man who walked on earth, our beloved Nabi Karim Sallallahu Alaihi Wasallam. He got it right. Here in modern times, you've talked about intelligent people, powerful people, extremely wealthy people. And as a psychologist, what do you think is the reason for the split? Why is it that we allow our darker sides, and we all have them, but why do we allow our darker sides of our personality to overtake, and we become these horrible people? Everybody avoids us, don't want to be in our space, etc. What's going on here?
I think, Julie, it is until we decide, because, we can say that maybe from psychologist side, modern psychology has distanced themselves from people's meaning frames, right? So there is not just a mere perception, but academics write about the fact that part of the problem with modern psychology that it is not infused with local discourses, with people's meaning frames. But on the other side, I think as faith-based communities, we will also have to go back to the drawing board, and we have to ask ourselves, in what way are we practicing religion, practicing psychology, or our faith, sorry, in such a way that we do not bring together the human with our prayers? How do we do that? So I don't have the answer. You know, I'm going to be clever here. I don't have the answer. But what I think we need to do is we need to go back so that we start reinterpreting spirituality and prayer, because worship includes smiling. Worship includes kindness and generosity. Worship includes having a spirit that makes people feel welcome, that makes people want to be with you. Worship includes enthusiasm and being excited and exuberance, you know, because I think we started to interpret spirituality to be very severe and only meaning prayer in the very ritualistic kind of way. But actually, part of worship is to seek knowledge. Part of worship is to have hobbies. Part of worship is to spend time with the family. You know, so I think we're going to have to expand our definition, because we've actually started to shrivel it up.
And I'm so sorry. I feel cheated. Honestly, I feel I'm cheating myself by not continuing this discussion with you. But unfortunately, we have run out of time. But absolutely fascinating. The next time you're in Johannesburg, we certainly need to meet up and continue this discussion. Thank you indeed for being with us.
It's a pleasure.
The amazing Dr. Shahida Jansen talking to us about spirituality meeting psyche. I found that truly fascinating, and I certainly am going to continue the discussion off air. Still to come on the show, we're going to be talking about the Syrian orphanages, and then we'll be talking maxillofacial surgery with Dr. Jamil Desai. Do stay with us. Welcome back. And no, we're not going to talk Syria right now. We're talking to a doctor. He is Dr. Jamil Desai. He is a maxillofacial surgeon, and we're going to try and unpack what exactly is that discipline in medicine. When is it that you decide to go to a maxillofacial surgeon? What is it that he is going to do for you? Dr. Jamil Desai, assalamu alaikum. Welcome to the program.
Wa alaikum salam. Thank you for having me.
Lovely to have you here. Always wanting to know what exactly is a maxillofacial surgeon. And I'm sure you get asked this question all the time.
Well, apart from being a mouthful to pronounce, it's one of those little known entities as a surgical discipline. It lends very strongly to a dental background as well as a surgical background. And in essence, what maxillofacial surgery encompasses is someone that deals predominantly with the face, as well as the oral cavity and related structures. So we do work in the field of trauma, in the field of tumor resections, and in the mouth we do wisdom teeth, and we do dental implantology, and our primary objective is to rehabilitate function and form, as well as aesthetics as a secondary concern.
Why would I come to you? You mentioned wisdom teeth, you mentioned implants, etc. Now, your regular orthodontist would be able to carry out the same function, I should imagine. Why would I come to a maxillofacial surgeon?
The orthodontist would love to think that they could carry out the same function. I'm sorry, I had to take a dig at my colleagues. Orthodontics is a discipline of straightening teeth. It's also a dental specialty. Maxillofacial surgery is a surgical discipline. So, you know, if you have teenagers that are experiencing headaches and pain in their jaws and so on, often attributed to impacted wisdom teeth, then you'd be referred to a maxillofacial surgeon to have these surgically removed. And also we deal with prosthodontists and dentists who are looking to rehabilitate patients' occlusion, bites as it were, by replacing missing teeth. And in order to do that, we need to place dental implants into the jaws, which would act as anchors on which they could attach teeth. So it's a multidisciplinary approach to rehabilitating a patient's function.
What about, and I think you did allude to it, is tumours, cancers, etc. I also understand that you work with the neck and the head, so that structure of the body is what you focus on. Talk to us about the challenges, very especially with tumours, with cancers, etc. What type of work would you be involved in, and how do you then help that patient or that person to get well?
Essentially, our work with regard to tumours would be treating benign tumours. It's important to understand the difference. Benign tumours are tumours that in essence would not kill you primarily, but are hugely disfiguring and hinder form and function dramatically. So we look at the odontogenic tumours, which are tumours that arise within the jaws and sometimes the soft tissues as well. And our primary objective would be to safely excise those tumours, to then reconstruct the patients by means of bone grafts, dental implants and so on, to literally try and get them back to their original form and function.
How do those tumours present, and do they create a lot of damage in the jaw or elsewhere in this upper structure that we're focusing on?
The sad reality is that these tumours are slow growing, and they're hideous tumours when you look at them, because invariably they become rather large. And given our South African context, a lot of our patients would be presenting very late because of the challenges that they would experience in the health sector, and also I think socioeconomically, being less aware of it. In the private setting, we fortunately get to diagnose these tumours a lot earlier, but in our less privileged communities, these tumours are unusually large, and I do believe in South Africa we have some of the largest specimens recorded.
Do we have enough maxillofacial surgeons in the state institutions? Because we know that the numbers obviously the state patients outnumber private patients by far, by millions. So how do those state organs then function efficiently enough to cater for those large numbers?
It's very challenging, Julie. We're a very small discipline. I think we're probably around about 115 specialists on the roll and producing very few annually. The bulk of the practitioners would be in private practice. There are a few facilities nationally that would encompass a state facility. But the huge challenge I think maxillofacial surgeons face in joining a state setting would be the lack of resources and also hospitals that are geared up for their services. So there are specific centres. You look at Johannesburg, we've got the Charlotte Maxeke Hospital and Chris Hani Baragwanath. Across the Yexkay River, we've got Steve Biko Academic and as well as the Sifato Makgato Hospital, and then the Western Cape and King Edward in KwaZulu-Natal. So and Bloemfontein. I think it's Pelanomi Hospital. So really very, very limited in terms of access.
Coming back to the type of work you do, we've touched on tumours. Let's look at trauma and the challenges in working with a trauma patient. I was once told by a maxillofacial surgeon that a youngster was beaten up with a bat, and I think his face was smashed up, and he couldn't even tell me how many hours he worked on the patient. Let's look at the actual work that you do and then the rehabilitation. Can you, and I know that no one can guarantee anything in life, but can you get the person to a state where they're okay with themselves, pain-wise and otherwise?
Well, this is the thing, it's a real challenge. Our work is very intricate. We've got the arduous task of having to reconstruct the patient to be functional as well as socially acceptable, not just for the public at large, but for themselves too. So, there are other factors that come into play. For the most part, I must say, we seem to be highly effective at getting that right. There are times, obviously, especially when patients present rather late, that it becomes a bit more challenging in terms of providing adequate aesthetic results. But this is our endeavor, is to return the patient to a form that is acceptable to both them and society in general.
We're talking broken jaws, broken bones, cheekbones, etc.
Correct, yes. We also repair orbits, which is the eye sockets. These are obviously devastating injuries with serious implications in terms of function. So we work closely with other disciplines as well, often with ophthalmologists and with plastic surgeons. But yeah, it's a very, very challenging field and a very rewarding field. When you finally get the patient like this and you manage to bring them back to a state that they feel comfortable with, it's a job well done, and it's really rewarding for us.
What are the challenges for you as a maxillofacial surgeon and generally across the board? What would be the greatest challenges when you're working with patients? And I know it's different from patient to patient or case per case.
I think it's one of those disciplines that requires a lot of capital input in terms of financial implications, especially in the private setting. We have huge problems with the health funders. Always having to motivate and to try and explain to them why it is that we need to do what we need to do.
Is it because they probably suspect that there might be some cosmetic surgery going on as well?
I've often thought about this question. It's a very important question, and I think one of the main reasons is that we often have a situation where people who are not suitably qualified are tasked with having to take decisions as to why a certain specialist needs to perform a certain procedure. And this sort of bureaucracy is what is really aggravating about being in practice as a maxillofacial surgeon.
Give us an example.
Well, here's an example. You've come to me and you're requiring a specific type of oral surgery to be performed, and I would contact your health funder and say, we need to do this surgery, and the immediate response would be, why?
And that's a clerk at the other end of the telephone.
Absolutely. They've got an algorithm that they're following on a computer screen, and if something does not tie in with what they're seeing there, it's an immediate no.
Right.
And we get grey hairs. I don't know if you can see mine, but we get.
And in the meantime, the patient might have died.
Yes, and or deteriorated,
Yes.
and this is very, very challenging. So fortunately, the status quo now is that there are certain conditions that are now deemed to be prescribed minimum benefit, which means that health funders are obliged to authorize and fund those procedures, which is just as well. We believe that there could be more procedures that could be added on to what could be classified as a prescribed minimum benefit. But these are challenges that we'll need to overcome in time.
Jamil, what do we as lay people need to know about maxillofacial surgeons and the type of issues we bring to you in terms of our general day-to-day things that go wrong with our jaws and our, upper facial structures?
Thankfully, most of what the general public will experience would not be life-threatening. I think that's the important thing, and that's what makes my discipline really nice, because it's not a very how can I say, it's not something that is depressing, for me to go to work every day, and like the cancer surgeons are exposed to on a daily basis. But the general public would understand that if they have problems with their jaws, they start experiencing pain or feeling little funny bumps and lumps, popping up here and there, or having difficulty with headaches and clicking jaws, and that sort of thing. These would be things that you might want to consult with a maxillofacial surgeon for, in order to get to the bottom of it. There are obviously more obvious things. You've been involved in a motor car accident, or you've been assaulted by somebody, and clearly something is amiss, fractured or broken. Again, you'd be consulting with us to repair that.
And there is hope if they go to someone like you.
No, absolutely.
Inshallah.
Inshallah.
Let's hold that thought. Let's take the ad break, and we'll be back with you in a minute.
No problem.
I'm talking to Dr. Jamil Desai. He's a maxillofacial surgeon. We are talking about this discipline in medicine, and of course we'll try and unpack as much as we can on the show. Do stay with us. We need to take an ad break. Welcome back. This is Let's Talk, and we're talking to a maxillofacial surgeon. He is Dr. Jamil Desai. Jamil, I hear we're still going to touch on all the very serious stuff, but I also understand that you've just recently relocated and you're in a new position. Please tell me that you haven't given up private practice.
Sadly, I have.
Oh.
I have. But I'm also delighted and very excited to tell you that I've embarked upon an academic career. So I've just been appointed at the University of Pretoria.
Oh, congratulations.
Thank you very much. As a consultant and senior lecturer. So it's a different challenge for me and really looking forward to it.
Good luck. I'm sure it's going to go well. So it's our loss as the general public that you're no longer in private practice. Why have you made that decision? Is this future growth for you?
I think it's different. It's growing in a different direction. I've been in private practice for well over a decade, and it's been a wonderful time in my life. But I think I've just been looking and yearning for something more. I always like to say that, you know, when you're in private practice, it fuels the bank balance, but it does very little for the soul. And you know, my intention now is to try and give back. And I know that sounds rather corny, but it is. You know, from the bottom of my heart, I've spent a lot of time doing humanitarian work up in Syria and Gaza with the gift of the givers, as you probably well know.
Alhamdulillah.
And it is just something that has touched my heartstrings, and I've just always wanted to go back and make a meaningful contribution and leave my mark on the profession, hopefully.
May Allah subhanahu wa ta'ala accept all your efforts and bless you abundantly for this amazing
Inshallah,
journey
Ameen.
that you're on now.
Thank you.
Back to maxillofacial. Now, you alluded to headaches and incorrect bites, either protruding jaw or recessed jaw, etc. And all of that, of course, is going to impact on your teeth, the wear and tear of your teeth, and possibly also, you know, present with lots of headaches. I'm thinking, why should I come to someone as qualified as you, a maxillofacial surgeon, for something as trivial as a headache, perhaps?
Okay, so it's an interesting question. Look, the area of headaches is a huge discipline in itself, encompassing neurologists, psychotherapists, all sorts of things. But we have a specific role to play, and that is in dealing with something called temporomandibular dysfunction. And a lot of people suffer from temporomandibular dysfunction, commonly known as TM joint syndrome. And it is essentially a disorder of habit. People are tending to clench their jaws, and it's usually stress-related, sometimes related to other conditions as well. But the primary feature presenting symptom would be the sort of dull vice grip-like headache over the temporal areas and the stiffness in the jaws. And you know, it can become quite debilitating because people become reliant on pain medication all the time. And we have lots of different things that we can do for that. You know, the construction of splints in order to assist with the function and treating the muscles directly. So it's quite a large discipline. And of course that leads on to other problems, notably problems with the jaw joint in particular. Which itself can then deteriorate and require further surgical intervention. So, you know, it is a rather in-depth...
So it's not as trivial as I had suggested, perhaps?
I'd like to think not.
Okay, I know that you've brought along some clips which we're going to take a look at in a minute or two, or it will play out as you and I speak, and we just also want to advise those sensitive viewers to perhaps avert your eyes. You can still stay listening to us, but avert your eyes from the screen if you are squeamish, because we're going to be looking at a few procedures that Dr. Jamil has undertaken. So what are those three that we're going to be looking at and talking about?
Well, let me just say off the bat that I had your viewers in mind when I selected the pictures, so they're not as graphic as they could have been. One of the pictures that you will see is a lady that presented to me in the state setting with an abnormally large tumor. And this is called an ameloblastoma. It's a scourge of South African population, very endemic to African cultures.
Why? Is it something to do with lifestyle or diet?
We think it's a genetic predisposition,
Okay.
and probably a point mutation as well. But it does develop from impacted teeth, oddly enough. And this is why it's so important to have impacted teeth assessed.
Sure.
Because primarily these tumors develop around an impacted wisdom tooth.
What does it mean when you say impacted wisdom tooth? What exactly are you saying?
All right, so the wisdom tooth is the third molar tooth, which usually presents at around about 16 or 17 years of age. If you do not have enough space in your jaw to accommodate the eruption of that tooth, they get stuck. And when they get stuck, they undergo certain changes in the soft tissues around that tooth, which may lead on to the development of a cyst or a large odontogenic tumor.
Okay.
So the picture that you will be seeing would be of a lady that had this tumor, and it started developing initially, and it was obviously smaller, and whether she was neglectful or whether it was just not knowing that she needed to seek some sort of attention for it, we don't know. But when I took a history from her, it was subsequently divulged that she had then at a later stage consulted an Inyanga, it's a traditional healer. And, obviously the treatment that was prescribed for was not going to work because this is a surgical problem. And at the time that she presented to me, she was having great difficulty functioning. She was having difficulty swallowing, and it was starting to affect her breathing. And obviously she was embarrassed because if you look at it, it's a hideous tumor. And she was locked away. So she was literally incarcerated by her family because they were embarrassed. And so she escaped and she sought treatment, and she was referred to me. And we performed a resection for her with a reconstruction. It was a 7 or 8 hour procedure. And I must tell you, she was absolutely ecstatic when I finally took a picture of her and showed her what she looked like. She could barely believe.
Have you got before and
I've
after
got an
picture
after
here?
Picture of her as
Is
well.
it probably on screen as you and I speak?
I'm hoping so.
Right. The second case you wanted to talk to us with pictures, obviously?
Yes. A lovely lady that was traveling and her vehicle overturned, and she sustained significant trauma to her face.
Oh.
As well as the soft tissues. I've included the scans. She had disruption of all her bones, fractures, eye sockets. She literally degloved her entire scalp in the forehead region. And, I performed the surgery for her to reconstruct all the bones and put them back into place, and then also do the soft tissue closures. And I've also included a picture that she sent to me roughly about 9 months afterwards,
Wow.
showing her as radiant and as beautiful as she was beforehand. So it's very, very rewarding. And the final one I've included for your viewers is a picture of what we can do for patients who are edentulous, dental cripples, literally. Where they grow extremely impatient and tired of wanting to function without teeth and using these removable dentures. So what we've done is dental implants for her to provide fixed anchorage points so that we can have fixed teeth, and in so doing improve the quality of life and the confidence of these patients.
Back in the day, as I was growing up, and you might probably also remember as you were growing up, is people had dentures. The moment our moms and our grandparents had problems with their teeth, there was no such thing as fillings, taking, care of your teeth, trying to preserve the teeth. The route they went was immediate extractions, and eventually it resulted in a lot of people having a full mouth of dentures. Is that a thing of the past?
I'd like to think that it's a thing of the past. It's a huge challenge. In fact, we and most dental professionals will tell you this now. We strongly advise against extraction of teeth wherever possible. And in fact, if we do wind up losing teeth, that we'd like to replace them as soon as we can. And the reason for this is the human jaw is a very, very strange and peculiar bone. If it is not loaded with a stress via chewing forces transmitted through the tooth into the jawbone, the bulk of the bone is actually lost, and we refer to this as a process of bone atrophy. And this then makes the patient visibly older because their face sort of all caves in.
But you can rebuild the bone. It's never too late, I should hope.
In a manner of speaking, yes, there are procedures that we can do, which is bone augmentation procedures, but it is really cumbersome and very laborious, and can be rather costly as well. So prevention is better than cure. What we'd like to say to people is that if you are unfortunately one of those that has lost your teeth, seek attention sooner rather than later, because you'd like to avoid all the elaborate bone grafting procedures, etc. Rather have the dental implants placed earlier so that you can maintain the bulk of that bone, and it's a lot easier to rehabilitate the patients at that point in time.
People who are having difficulty with the older people, where they have very sensitive teeth, and obviously with age your teeth tends to start wearing away. Would I be correct in saying
Correct.
that? Is it possible for them to go for implants at a later stage in their life? I'm talking 50 plus people. Is it a good idea, and would it work well for them?
All right, so people that find themselves with this condition, we refer to that as dental attrition. It's sort of a wear and tear pattern that occurs to one's teeth as one gets older and you've been using your teeth for many, many years. I think the first point of call would be to consult your dentist or a prosthodontist, who are dental professionals that specialize in attending to those teeth and adjusting the bite accordingly. So you need not necessarily extract those teeth. You know, they may be crowned, there may be things that you can do to those teeth to preserve their longevity. And I think it's important to understand that your own teeth, you know, it's a gift from the Almighty, is always better than anything artificial. But implants then become rather meaningful when you've missed that opportunity to preserve your teeth. And it's at that stage that we advocate the use of dental implants in conjunction with prosthetics.
This time of year here at ITV, we do our social responsibility bit, and that is to make young people aware of career opportunities and options going forward. What would you say to young people watching us this morning? Why should they choose to go and specialize in maxillofacial surgery?
All right, so firstly, you've got to become a dentist, sometimes with or without a medical degree, and then you have to undergo training as a specialist for a further 4 to 5 years. So it's a lengthy road to walk, but it is extremely, extremely rewarding. You get to use a small percentage of your brain. I say that tongue in cheek, but also you get to use your hands. So if you're the type of person that enjoys using a little bit of brain and is handy with your hands,
it's hard work. It sounds like hard work.
It's carpentry. It really is. But it's very rewarding. You keep reasonably good hours, at times, but at times you also have to sacrifice when you've got after hours cases and emergencies to deal with and so on. But it's a very gratifying profession. It's a very rewarding profession.
And let's be fair to our viewers. What's the downside to the profession?
Honestly,
nothing.
I've got no regrets. I've had no downside. It's been such a blast for me. I always say getting up and going to work on a Monday morning isn't laborious for me. I love it.
That's wonderful. It's great to hear people saying things like that. In closing, your final words to our viewers this morning.
Well, I'd just like to say I hope that I've managed to shed a small little bit of light on what it is that maxillofacial surgeons do. We always like to inform the public and say to them that there are people out there that can help you with regards to certain conditions and so on. And if you're in doubt, best consult your dentist or your GP doctor and ask them, is this something that I need to see a maxillofacial surgeon for? And they usually have the necessary skill sets to be able to identify the problems and to refer accordingly.
Jamil, that was absolutely informative. Thank you indeed for letting us into the world of maxillofacial surgeons. I really had no clue what it was all about, and now I have some understanding of exactly what it is that you guys do. All the very best for the future, the path that you've now taken. I know that you're going to touch lives in a very positive way. Thank you once again for your time.
Jazakallah, thank you for having me. It's been a pleasure.
My pleasure entirely. That was Dr. Jamil Desai, a maxillofacial surgeon. He has now gone out of private practice. He's going to be lecturing at the University of Pretoria. And of course, he's given us some sound advice, especially to the youngsters who are wondering what they'd like to do with their lives. Those of you, of course, who are at med school, here's a possible avenue for you. Still to come, we're going to be talking about Syria orphanages. Do stay with us. And into the final segment of the show today, we have a father and daughter duo, Junaid and Nadira Chenya. They're here to talk about something that's really close to their hearts, and that is the Syrian orphanages. And I think it goes way beyond Syria. I'm going to introduce them to you, and they're going to tell us their story, how exactly this family, the Chenya family, become involved in such amazing humanitarian work. Junaid and Nadira, assalamu alaikum, welcome to the program.
Alaikum salam, thanks for having us.
Wa alaikum salam, thanks for having us.
Lovely to have you here. And you know, as I sit here talking to you, we were talking off camera just now, and I was quite blown away when I heard just how involved you are as a family as far as humanitarian work is concerned. Junaid, how did this all start?
Actually, in 1998, we migrated, my wife and my 3 daughters, to Australia. And we stayed for a good number of years in Australia. And then in 2009, we decided as a family, the daughters actually inspired me to go and study Arabic in Jordan. And
what was the reason for that?
It's just that they felt that they needed a change. They needed, and because obviously we read the Quran, we do so much of our reading in Arabic, but we don't understand Arabic.
Absolutely.
So we thought this was a fantastic idea, and I said, look, this will be a great opportunity to expand our knowledge in Arabic. And we went on this...
You uprooted the entire family?
Uprooted the entire family, and we went to Jordan, and it was a fantastic journey, because when we got to Jordan, we rented a place close to the masjid, and the masjid, I befriended the muaddin of the masjid, and he was doing this work of charity for many years. And I started joining him every Saturday on my free time, which I was not studying. I said, look, there's a great opportunity. And then,
what year was this in?
2009.
Okay. Pretty recent.
Yeah, pretty recent. And I started joining him, and every Saturday we would go out and distribute to the refugees, families and orphans, food and money, etc. And the thing, an incident that took place that really stands out was one Saturday when we went to do a distribution of money and food. And when we went there, we distributed, and we could not distribute all the money to the rest of the families because there was not enough money.
Ooh.
So we were so heartbroken at that time. And immediately we headed back to Amman, which is about 40 kilometers away from Zirka. Now Zirka, you got to understand, is has the oldest and the biggest refugee camp in Jordan.
The Syrian refugees.
It's got Syrian refugees. Obviously, it started off with Palestinian refugees, and then Iraqi refugees. And then with the influx of Syrians, it's now got Syrian refugees. So and
it must be huge.
It's huge. Mm-hmm. So, and the brother Abdul Hadi, who's the muaddin of the masjid, he's been doing this work for many years, and he was doing it on an informal basis. Very informal. I mean, not any structure to it. So when we headed back to Amman, it was a time of Salatul Maghrib at the masjid. As soon as Maghrib Salat finished, someone came, because we couldn't give all this money to, there was a lot of...
There wasn't enough money, to cover everybody.
To cover everybody. And we were so sad, and we could see the sadness on the faces of the families. So when we headed back, it was Salatul Maghrib, and as soon as Maghrib Salat finished, somebody came and handed an envelope of money to the brother Abdul Hadi, which I was shocked. I mean, it was like God sent, and that was enough money to cover the whole family, the rest of the families. And that was such an amazing thing that at that moment, I just felt that Zadkom was born.
Is that the name of the organization?
Yes.
Just spell it for us.
It's Zadkom. It's actually Zadkom, Relief and Development. But in Arabic, it's Zadkom wa Tanmiya wal Ighatha.
Okay.
So to increase in your giving. Zadocum is to increase in your giving. Yeah.
And that's how you started the organization. What's your role, and how did you feel at the time when your dad became so involved in Jordan with these relief operations?
So it was really good. We at that time, my sister and I were really involved with our studies, so we didn't really go with him. But when Zadocum was established in 2012, then my husband and I, we run everything here in South Africa, basically. We get all of the funds because they don't get many funds from Jordan itself. So we've got ourselves registered now in South Africa.
How long is it that you've been registered? Because I must admit, I've never heard of this organization before.
So we only recently got registered.
Okay.
But we have been raising funds since 2012. So, and now we are also registered in Australia. Like my dad said, we grew up in Australia. So now we are also registered in Australia, as well as Jordan, and now South Africa recently, alhamdulillah.
So apart from fundraising, what else do you do?
So
just focused on the fundraising.
So we just focus on the fundraising. I'm actually at the moment, I do a lot of things on social media. So I'm trying to sort of get people involved and get a team involved, so that we can actually go once a year and, you know, do the distributions and see how these people are living and things like that. I think it's very important that we get involved hands-on. So my dad does go pretty often in a year, especially before Ramadan, because Ramadan is our biggest distribution. So I would like to get a team together and go down at least once a year and do that.
So as a team that you're focused on, who is it that you want involved, and what sort of services are you expecting from the team to support you?
Okay, so I'd like to get some journalists involved, as well as people that are involved with social media, because I really feel like social media and things like that are, you know, gets the word across.
Absolutely.
I've managed to raise a lot of funds now recently just through social media. And so basically I would just love people to come. I want to actually focus on a documentary focusing on the refugee camp and, you know, the orphans that are there, because we actually have case studies on each family and each orphan. So it's really amazing to go and visit them and see, you know, what their issues are and how we can actually help them.
Now, something that's very close to my heart, and I should imagine as a woman close to your heart, and all moms and women watching us this morning, is the issue around orphans. What exactly is the state of play as far as the Syrian and other orphans are concerned? How are they being cared for? How are they being managed? And is there at all a possibility that they could be adopted? Because if that is a possibility, I have no doubt in my mind that South Africans will open their hearts to those orphans. Junaid, would you like to respond to that?
Firstly, look, the orphans, like we do a case study, each family and orphans, a proper case study is done. What's the condition of those orphans, how their living conditions are. So we make sure that we actually cover an orphan for 1 year, basically. So it's basically $600 that covers an orphan for a year, and $1,200 that covers a family for a year. So basically, when you're talking of adoption, the government, the Jordanian government, doesn't encourage it at all. I don't know the actual reason, but when you talk on the subject of adoption, they're not keen at all discussing that matter. I don't know if they don't want that for any reason, because of the children. Maybe they don't want to take them out of the environment. They
to
feel
lose their identity, their cultural and religious identities.
So I think that could be one of the reasons, but I'm not too sure on that. So what we do is we try to sort of fulfill our obligation, what we can do on the ground, and see if we can sort that out and see to their needs, the refugee camp, and what we can do to improve. We've done a lot of things to improve from not the relief side, it's the development side, which we feel plays a very important role in their lives, especially the women, the children. If we can develop these families, develop the children, I think, and they become self-sufficient.
Okay, let's talk about the type of development that you have targeted with these children and these families after the ad break, and also about your fundraising efforts in Australia. Is it as lucrative and good and big-hearted as it is here in South Africa. All of that after the ad break. Father and daughter duo, Junaid and Nadira Chenya, in studio talking to us about the relief work being undertaken in the camps, the Syrian camps in Jordan. And of course, we will unpack lots more right after the ad break. And we're into the final segment of the show this morning with a father and daughter duo, Junaid and Nadira Chenya, talking about their fundraising efforts, not only here in South Africa, but in Australia as well. Junaid, we were talking about developmental initiatives that you are running in Jordan in the camps.
That's good.
And the amount of families we've touched. Now, I want to talk about what sort of developmental programs these are. We'll get back to that in a minute. Nadira, you want to talk to me about the number of families that have been uplifted and supported through these fundraisers.
So it's really good. We started off actually in 2012 with a building that we rented and turned into offices, and we started with about 50 families and about 30 orphans.
And this is in Jordan?
This is in Jordan, in the city of Zarqa, yes. And now, alhamdulillah, this year, with the help of many people, we have purchased a house which now can facilitate for many activities and programs, because now we have from 50 families, we now have 1,500 refugee families that are registered with us, and from 30 orphans, we now have 650 orphans. So as we get more money and we raise more money, we can actually register more families and more orphans with us. So that's also another...
To go through the development program.
To go through the development, to sponsor them, to take care of them, things like that. We run a number of programs from the offices. We, with regard to development, we do a lot for the refugee ladies as well. They have tafsir classes, they have madrasa classes, as well as for the orphans. We have computer classes, medical checkups, things like that, you know, to develop.
Are there anything in terms of upskilling them so that they can become self-sufficient? You're nodding your head, Junaid. Would you like to come in there?
No, I mentioned to you about the ladies that, you know, the empowerment programs where these come from war-torn countries, and these ladies are so...
almost a lost generation.
Lost generation. Mm-hmm. And when we have these empowering programs to show them that they belong to society, they can still have a good effect in society.
They are worthy.
Yes, and they can play an important role in society. Mm-hmm. So, alhamdulillah, what these programs, we feel that the people are becoming much more confident and bringing their life back to, you know, what can I say? They sort of...
Almost normal, as normal as you possibly can get them.
So...
Junaid, are you not, and you, Nadira, as well, do you ever have doubt as to, you know, I always say people like yourselves are absolutely amazing. You are so passionate about uplifting people in war-torn regions. But there are so many other people and organizations out there as well. Are you not ever afraid that there's too much happening, too much being given out in the form of aid, that it makes people almost complacent, and they're going to sit in that complacent space of theirs and just expect the handouts all the time?
That's what we felt at the beginning, that relief, you know, all the time relief. What we're doing with development, and this development thing that we are trying to sort of put in place. And if we can work on the development side of things, I think it will make a huge difference to these families, orphans, and it will make them self-sufficient. That is what we need to. The more people become self-sufficient, it will make it easier for the people that are sort of donating.
So to put it simply, what you're thinking is rather to give someone a fish for the day, teach them to fish for life.
100%.
Alhamdulillah. Yeah. Your thoughts, Nadira?
At the moment, you know, I've just been we get really busy during Ramadan. Alhamdulillah. Sometimes, actually, on that point, sometimes in South Africa alone, we have so many organizations that you wonder, are you going to make the funds up for these families? Because people are skeptical to just give to anybody. But, you know, alhamdulillah, every single year, even though we've been expanding and having more orphans registered with us or more refugees with us, we always manage to make above the amount.
Alhamdulillah.
So alhamdulillah, that's been really great. My father, in fact, goes down about twice or thrice a year for a few campaigns that we run. Apart from the Ramadan campaign, we have the campaign for Eid al-Adha, where we distribute meat and we slaughter the animals, as well as a Zat al-Zayd campaign and a winter campaign where we hand out blankets and heaters. And every single day throughout the year, we hand out bread in the refugee camp. So that's something that every single day. Mm-hmm. So that's also good.
Junaid, you grew up in Roshni, you then went to Australia, you went to Jordan, you're now based in Dubai, so you're an international traveller, so to speak, or you have homes all over, and obviously this is in keeping with the type of work you're involved in. Fundraising in Australia and other parts of the world, is it as easy as it is in South Africa?
Alhamdulillah, Australia is getting much better. I mean, there's a lot of strong organizations there as well. But the generosity of our people here in South Africa is tremendous. I must tell you that that's something that makes us South Africans such strong people in giving. And Alhamdulillah, Australia, like I said, we're getting there. I get a good amount of funding from Australia, but not as good as South Africa. Mm-hmm. So with the South African generosity, Alhamdulillah, we can achieve our goals and continue supporting these families.
Now you guys are really vested in this project, this fundraise of yours. It seems like you work long and hard hours trying to get this going and to sustain it. It's a full-time job from what I hear you both telling me, and you have immediate family members involved as well. What about other people wanting to get involved, and how much of time would they have to commit to being a part of the organization?
At the moment, it's just about the fundraising for us in South Africa. So just to
but it's a full-time job for you.
It's a full-time job for me, but just to get the word across and to raise the money is important in South Africa. Like I said, it would be nice if people come and see for themselves. And we have a few people that have come, and when they stop in Jordan, they want to see the organization, and they come, and then we do organize a few things for them to get involved in. So, so at the moment, that's all we can really do is raise money, raise awareness, and tell people what it's really about.
Nadira, you based in South Africa. Junaid, you are based in Dubai. Who runs the organization, the day-to-day running of the center in Jordan, and to see that it's effectively managed?
We have 15 ladies that are doing this work on the ground. At the office, we've got a lady there who heads the whole organization. She's 17 years in this work of
Jordanian.
She's Palestinian.
Okay.
And she's got a good knowledge of the refugee camp. So she heads things for us on a day-to-day basis. And then we've got obviously the founder of this whole thing is, I've got to say again, is Muazzin, the Muazzin whose name is Abdul Hadi. He's the founder. And we have another brother whose name is Kamal Al-Barghouti, who's very good in social development and things like that. So they are day-to-day, they run things, as well as we've got 15 ladies who give their entire day doing this work. So the sincerity and the dedication they put into this, I can't believe you if I tell you how much of hours they spend on a day-to-day basis.
There are amazing people like yourselves trying to uplift those that are less fortunate, obviously. And of course, for work like this, we know that we get our reward from Allah subhanahu wa ta'ala, and He will forever bless you and guide you, inshallah. What are the challenges that you face, and what is it that you're wanting South Africans to be involved in as far as your work and your organization is concerned? So let's start with challenges first.
You wanna?
I don't exactly know the challenges on your side.
Yeah.
But
on your side,
on
Nadira?
my side, the challenges, as I've said, is to get people to contribute, because they always ask you, are you this organization or that organization? If you don't have a certain title, they're not really willing to give.
They're a bit reluctant because they're not sure if the money is being
sure.
channeled in the right direction.
And the thing about us is we have taken it upon ourselves. There is no admission fee at the moment. So we've taken it upon ourselves to make sure, and my father makes sure that the money, 100% of all the funds, get to the families and to the orphans. And at the moment, so basically the challenge is just to get people to contribute without doubting.
Inshallah, inshallah. With a minute to go to wrap up time, Junaid, to you.
I feel the challenges are like Nadira mentioned is people trusting you and the organization, exposure of the organization.
But alhamdulillah, Junaid, you come from a very reputable family and reputable background. Yes. So you're a very known entity in South African. People can give knowing that the money is going through to the right channels. But in Australia and Dubai, etc., you need to still establish yourself.
Alhamdulillah, we're building that reputation in Australia, where a lot of people now getting to know Zaadcom and knowing that the administration cost is separated to the actual funding of the orphans. And so basically,
because sadly there are organizations where 40% of the takings go to admin fees, and that's a crying shame.
Yes, and I think that is something we can show out there, that this is what we're doing, which people get very very enthusiastic to give, because they see that the admin cost is not
and you've got financials and checks and balances in place.
Yes, we do have that. And the challenges are, like I said, is, like in Jordan, it's not as easy as South Africa, where we can get things going, where we can find, easy things to do, basically to get funding going, and that Jordan is difficult. But with our effort and constant effort to sort of go out there and make things happen, alhamdulillah, Allah opens that way. He always gives us that, that opens a path for us to sort of
well,
continue.
like they say, if your heart is in the right place, and if your niyat, your intention is the right intention, then Allah does open the path for you. Yes. In closing, what is the message you want to leave our viewers with this morning?
I would like to tell the people of South Africa, the brothers and sisters who have contributed, and inshallah who will contribute to this cause, that they are welcome at any time to come and visit the office in the refugee camp, to see on the ground what is really happening out there, to see how these families live, the conditions of these families and orphans, and inshallah their hearts will go out there and can contribute much more, inshallah.
May Allah subhanahu wa ta'ala accept all of your efforts, all of your du'as, and may you guys be blessed to carry on the amazing work that you're doing. Thank you so much for sharing your story with us on air this morning. Assalamu alaikum to you.
Thanks for having us.
My pleasure. And that then brings us to the end of the show this morning. I sincerely hope that you enjoyed being with me. Till the next time, as always, it is Khuda Hafiz from me, Julie Alli. Ya hala, 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 ya hala. يا هلا ويا هلا ويا هلا ويا هلا، حن قلبي على جمعة الخير هلا، حن قلبي على جمعة الخير هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا هلا ويا هلا